Hi, everyone. On today's podcast, we're going to talk with labor and delivery nurse and the founder of Bundle Birth, Sarah Lavonne, about supporting families so that they can have a confident and empowered birth experience. Welcome to the Evidence-Based Birth Podcast. My name is Rebecca Decker, and I'm a nurse with my PhD and the founder of Evidence-Based Birth. Join me each week as we work together to get evidence-based information into the hands of families and professionals around the world. As a reminder, this information is not medical advice. See evbirth.com/disclaimer for more details. Hi, everyone. My name is Rebecca Decker, pronouns she, her, and I will be your host for today's episode. Today, I'm so excited to talk with the founder of Bundle Birth, Sarah Lavonne. Before we interview Sarah, I want to let you know that if there are any detailed content or trigger warnings, we'll post them in the description or show notes that go along with this episode. And now I'd like to introduce our honored guest. Sarah Lavonne, pronouns she, her, is a pioneer in nursing and birth education and the founder and CEO at Bundle Birth, a nursing corporation. Sarah is a registered nurse certified in inpatient obstetric nursing, a certified childbirth educator, and a certified lactation education counselor. With a vision to unite patients, support persons, and medical personnel together through education and support, Sarah and her team at Bundle Birth have fearlessly developed a community of learning and inspiration across labor and birth. Sarah dreams of all birthing people having not only a healthy birth with safe outcomes, but healthy birth memories. She offers a spectrum of services from support to on-demand classes to a robust online YouTube presence. Sarah loves seeing families and nurses transformed from nervous and overwhelmed to confident and transformed. We are so thrilled that Sarah is here. Welcome to the Evidence-Based Birth Podcast.
Thank you so much for having me. This is truly an honor to be here.
So Sarah, we've been following your work for a while, and I know you followed EBB, but this is the first time we've collaborated on an interview together. So we're so thrilled. Can you go back towards the beginning of your story and tell us about your journey to becoming a labor and delivery nurse?
Yeah,
I know you went straight from nursing school into labor and delivery. So tell us all about that journey.
Mm-hmm. Yeah, so I've been in Los Angeles since nursing school. So I grew up in South America in Ecuador and then moved to the States by myself. And remember, this is sort of dating myself, but this was like right when Wi-Fi was coming out. So I look back at that experience and just like how much I didn't know and how little I could Google everything. And I like learned a lot about living in the States in that amount of time. And then that experience sort of led me. I knew I wanted to do nursing, but as far as labor and delivery, I started working at Children's Hospital of Los Angeles, learned quickly that pediatric nurses are the most amazing, one-of-a-kind, unique types that I am not. And so I was sort of dabbling between pediatrics and labor and delivery. It's a crazy story, but I ended up getting hired. Of 900 applicants, there were 2 positions, and I got hired as a new grad into labor and delivery right away. And really the dream was I had been a part of SAD nursing, and all nursing is sad in some ways, but there's certain specialties that are more sad than others.
Yeah, can you pause a minute? What do you mean by sad nursing?
Like just where you're dealing with the spectrum of life, where it's sort of you're dealing with the end of life. And nursing in general is dealing with health and wellness and helping people be well. But that doesn't always happen. And I was particularly in pediatrics. And then through my clinical rotations, I had so many experiences where it was just, I walked away just like miserable and so affected by being around death regularly. And I knew that like, while I actually really liked certain elements of that, I thought about labor and delivery. And also we'll get to the patient population side of things. So there was a combination, but it was like, I don't know that I have it in me. This will wear out my soul to be around this day in and day out. And I was so deeply affected by like, especially pediatric loss. And mind you, I will say labor and delivery, when it's sad, it's really, really sad. But for the most part, you're on the other spectrum of life. And so I liked that more positive side of nursing for that. The other side was I knew I loved working with young women and birthing people. And so it was like, I liked that like younger population. Then I also loved babies. And so I will say that going into labor and delivery nursing, I don't know that I knew exactly what I was getting myself into. Do we ever as nurses? But I knew that I didn't want to do pediatrics. And when I did my clinical rotation as a nurse, I loved it. Like my soul came alive. Everything about birth and the process was just like fascinating to me. And my clinical instructor knew that. She'd like pulled me from the postpartum side and put me in more births. I saw like, I think it was 13 births as a nursing student, which is insane. You're lucky to see like one or two normally. So it was a combination of things. I think my pediatric experience and loving that, learning so much, but also just being so sad all the time because of it and so deeply emotionally affected. And then the fact that I just loved birth, I think led me, and then I got hired. So ultimately, like, especially that was back in the nursing shortage where like there were nursing students from my class that didn't get hired for 2 years on the floor. And so
So it
I
was
got
a
hired.
nursing surplus at the time?
Yes, thank you. Nursing surplus, where like
Very brief
there were
one. Yeah.
yes, the opposite of what's happening right now, where like you couldn't get a job as a nurse. And so of the 900 applicants, it was a very clear movement into labor and delivery. And what I found when I got there was, I remember my very first shift, I called my parents in Ecuador and I was like, this is so hard, but this is amazing. Like I will do this the rest of my life. And thinking how many people have multiple careers. And now like I've had multiple careers just all within birth and shifted things along the way. But I just was like, this is literally my soul is gonna just thrive here. I love it. It's so hard. I am completely overwhelmed, but I love this so much.
Well, tell us about being what I like to call a baby nurse. When you are just starting out after school, that first year can be really rough.
Oh yeah.
You said it was hard, but it was good. What are some of the memories that stand out or some of the experiences you had that first couple of years?
Yeah. So I started at a hospital in East LA. And because of my experience in Ecuador and being fluent in Spanish, that was, I think, not only was it amazing for kind of bringing my worlds together and nursing school, Ecuador, all of that, but also the patient population was my favorite. Still to this day, when I joke about going back to the bedside, which I don't think I will, but I always say like I would go back there because it was the most incredible, diverse experience, which with labor and delivery, what that means is I got to see a whole lot of births and a whole lot of unique, different birth experiences and a diverse experience, not only in the way people labored and their family histories. And I got to use my Spanish. So I got to connect on a really deep level with my patients, which I loved. But then also I got to see the sort of actual nursing side of things, which I think a lot of people think labor and delivery, you're just catching babies all day. And I say it's happy nursing, right? For the most part, it's happy nursing. But there are complications that can happen. And the population I was working with was a high risk population. And so I got to see and experience all of these complications and carry these families to the finish line, hopefully as intact as possible. And I realized that I really liked that too, that there was an element of like, I'm kind of the adrenaline junkie. Like I liked the high risk cases and I liked kind of figuring out how to get them there and how to keep them safe. And so early on, I think back to that experience of being at that hospital, I remember being told in orientation that working here is like working for a year is like working for elsewhere. It's like, you get to see everything. And I really did. And so whether that be the like perfectly normal expected birth, that's their first to 15th child, no joke, to the really high risk, keeping them safe, where it's like really a medical birth. And I loved all of everything in between.
So what happened next? You got your feet wet as a labor and delivery nurse. You were learning so much. What was the rest of your experience like in the hospital?
Yeah. So I was a floor nurse, staff nurse, and I ate that up. I realized very quickly, and again, this is my first career. So I was 22 when I started as a labor and delivery nurse. And I learned about myself that I like to be challenged. And I learned pretty quickly. And I'm pretty self-motivated. And so I got to a place probably a year and a half in where I was like, I don't know that this is all of how we do birth. And so I wanted a second job. And really, I also looked at my student loans and was like, I'm going to be in debt for the rest of my life if I don't do something about this. So I got a second job specifically in a completely different world to give me a diverse experience. And that was in the heart of Beverly Hills at a very prestigious hospital in Beverly Hills with like a completely different patient population, all private doctors. And that just really like all of a sudden woke me up. I remember I was at the bedside and this nurse was like, yeah, we could use a stirrup to put their leg when you turn them to the side to hold their legs open to like put them in a different position. This was the beginning of my physiologic birth days. And I was like, what? We can use the bed? We can change them in this position? Like it just all of a sudden started opening my eyes to a different way of birth and labor and how other providers may assist families to the finish line. And so started in Beverly Hills and then very quickly there was selected as a group of, there were 8 of us nurses to revamp their childbirth education program. So I'd always loved education, always spent a ton of time at the bedside educating my patients and had like kind of my way of explaining things. And so they pulled us from the floor for 4 months and we, alongside of Anna Paula Markel, who is a doula here in LA, she's very involved with DONA and like incredible. They brought her in to help develop a hospital-based childbirth class with more of a, I'm going to say natural approach, less hospital-based, more sort of well-rounded in its approach for childbirth ed. And so I learned to teach childbirth classes, developed some specialty classes and taught those, and then really found that experience, seeing families prior to coming to the bedside, because as a labor and delivery nurse, we see them, they come in labor likely, or maybe to be induced or whatever their circumstance, and then they have their baby and that's the only interaction we have with them. Whereas now seeing their concerns, seeing their fears, their anxieties prior, and then watching them show up to the unit after having taken a class completely transformed and comparing that to the experience of people that don't do education, I can see a visible difference in how they carry themselves, how calm they are, and their experience. And so I loved that side. I feel like it created this diverse, newfound passion in me. And it's still birth, but it's sort of like just like another branch or another way that you can go about being involved in that world. And so I started teaching those childbirth classes. Eventually, they actually brought me into a peer mentor role where I was training labor and delivery nurses once they got off orientation and doing other nursing education on the floor, being a resource. So they pulled me from count, meaning I didn't have my own patients. And I basically roamed the floor helping people and seeing how nurses practiced and filling in the gaps and coming up with, like, we need some work on learning about fill in the blank, XYZ type procedure. So that I would train the nurses on that, which led me into an administrative role managing the childbirth and parenting education program at that hospital. So at this point, I quit my job at the other side. I've paid off my loans, hallelujah, and went into an administrative role, which again, just showed me the management side, sort of like the business of the hospital and being a part of meetings with higher ups in the hospital, seeing the way it runs, having my own team and developing them and improving the childbirth and parenting education program was also just thrilling. So I've done a lot and it sort of led me to where I'm at now. I think each piece looking back, I'm like, I couldn't see it then, but now I can see now how those diverse experiences in birth and in education, in the community, and then also in the hospital have kind of led me here.
Mm-hmm. So do you feel like you saw amazing, incredible care and births? Did you also see like the opposite side where there was a lot of shortcomings or things that you didn't agree with? Like, tell me a little bit about that.
I have a lot to say about this one. So I think partially, yes, I think that starting with what I saw in the way that people practice, I think that medical people, nurses, doctors, the people that I was working with have the best hearts. Like they're some of the best people I've met. They mean well, most of them. Obviously, you have the one-off, but in general, they mean well. But what I was finding was there was a disconnect between especially what they were being taught and then they'd show up. I mean, this is evidence-based birth, right? So they'd show up and the patient will have done the education. And this, even currently, I had struggled with early on in bundle birth days, where they've done the education, they show up to the hospital and the nurse is like, nope, I don't like that. Nope, I don't feel comfortable with that. Nope, that's not how we do it here. And that's really disempowering as a family member or a birthing person who's like, I did my homework. Like, I'm ready. Like, we're on the same page and like, you're the expert here. So I would assume that you would know this stuff. But that wasn't always the case. And so that disconnect, absolutely, I think what we're teaching versus what we're practicing. And they say in the medical world that like any change, any practice change, any evidence change takes like 5 to 10 years or something. We're the slowest to move. Now I would say probably a little faster thanks to technology and the internet and stuff. But still, like to change your practice, especially as nurses, when we have less control over the room, when the provider, the doctor, the midwife is going to be the one kind of like running the show, I think, yeah, there was a good amount of disconnect. And then the other thing was just this centering around the patient that I just was like, the shared decision-making has always been something that's been a passion of mine. I actually found recently, I won a shared decision-making award at some point along the way. I have no idea where, but it goes to show that like the idea that you have control over your body, that you have control over your choices, that the provider's job is to help you understand the risks, benefits, other options. And then the shared decision-making model is, how do you feel about it? That there's actually a discussion, given that it's appropriate and not an emergency or something, but there's a discussion. How do you feel about it? What concerns you? What sounds good about that? And then the patient or the family comes to a decision for themselves. That's always been a passion of mine and something that I wasn't seeing happen all the time.
Okay. So you weren't seeing that all the time. Did you see
No.
it more with certain populations than others, or did even the privileged clients in Beverly Hills struggle?
Oh, yeah. Especially if we're going to compare locations and patient population. I think one of the things that was sort of this like stark shocker to me when I just had never been exposed to it before, that the hospital in Beverly Hills, the patients were very educated. They came in, they'd done their work. They had questions like I had never been challenged with before, where I'm like, whoa, I don't actually necessarily know the answer to that. Or let me get your provider in here for that. Whereas I just wasn't used to being challenged in what we did. And how I was taught was, this is just the way we do it. We come in, I'm starting your IV, I'm checking your cervix, we're doing a C-section, we're da-da-da-da-da. Fill in the blank versus that shared decision-making model. And that was, once I saw the other side, I was like, wait, hold on. This is not okay. And the patient population in East LA was mostly Hispanic, Spanish speaking, Medicaid or Medi-Cal. And it was, there was no autonomy over their decision. It was very culturally, yes, doctor, yes, nurse. I was called doctor all the time, where I'm like, no, I'm your nurse, and luckily I was there like sort of translating, and I was able to help have some of those conversations with my patients. But absolutely, it was,
it reminds me of one of my kids' like kindergarten classes where they say you get what you get and you don't throw a fit, kind of like, yes.
Yes.
You get what you get. You don't throw a fit. This is what we do. This is how we do it. You don't really get to question us.
Mm-hmm. Yeah, okay. Absolutely. Absolutely. And that's how I was trained. That's all I'd seen for a year and a half. And it was just like, oh, okay. And I think about myself now and I'm like, how did I not question that? But also, you're a new nurse. You don't know any better. You're terrified every single time.
And you're socialized into that. Like,
totally.
It's drilled into you. This is how we do things. We follow procedures. We follow protocol.
Yep. Yeah. And I knew that policy and procedure manual like the back of my hand. When I found that thing, I was like, I'm going to memorize this because this is going to help me know how to do my job. And so I was very regimented. That's just not how we do it. No, that's not an option. Oh, no, we don't get you out of bed once your water's broken. Like, that was absolutely how I was trained. And then all of a sudden I got this diverse experience where it was like, oh, no, we can get it. Let's get him in the shower. Let's get him in the bathtub. Let's walk him down the hallway. I was like, huh? It was very stark difference in practice. And it was very population based, mostly upper class in the Beverly Hills Hospital, and private doctors whom are being demanded a certain thing, who are on social media and on the news and taking care of celebrities, where like there's competition. It's sort of like, it was a whole different world. And absolutely there was a different way of practicing. Now, mind you, what I see now is different than what I saw back then, even as far as practice changes and how we're sort of approaching families. So I've been a nurse for, I think it's 11 years. I was trying to figure that out the other day, but 11 years. And in an age where, again, I started nursing school where Wi-Fi wasn't a thing. And what we've seen since is just, there's been a lot that's changed.
Mm-hmm. Yeah. So tell us what inspired you to create Bundle Birth and what all you're doing there.
Yeah. So I'd done a lot in the hospital and I got into management and it was kind of like, I loved the team aspect. I loved the leadership. I loved the strategy and sort of the knowing the ins and outs. But I was like, man, I really miss birth. Like, this is not it. But then when I was in birth, I was like, I feel like I have all these gifts and skills that are just not being utilized. And so I had seen like what was happening in the community, in the hospital. I was like, I have this dream. We should create a center for all things birth. It could have like education classes and group prenatals and all these things. And they didn't want anything to do with me. And I just was like, okay. And so I was sort of trying to be creative with how do I continue to innovate and help? I am a fixer. I love helping. I love education. I love people. And I was just like, oh, I don't know. And everywhere I went was a roadblock. It was just no. The answer is no. And if you've worked in a hospital system, you know that the hospital has a lot of red tape. You want to put a flyer out on a unit and it takes a year, you know? And so I sort of got to a place where I was like, I think my soul will die here. And I remember saying that and being like, whoa. And I had a hair appointment later that day. And I was like asking my hairdresser, like, what does it take to become a hairdresser? Like, and I was in this sort of in-betweener, like, this isn't it for me. I have so much more that I feel like I can offer the world of birth. I'm not done in birth, but I'm not totally satisfied. And I see so much area for improvement. And so I sort of determined that I felt like I had maximized my reach from the inside out. And it was like, well, you can go from the outside in. That's the other option. And so not knowing at all what it's like to be an entrepreneur, not knowing anything about business, never a business class in my life, I quit my job and said, I'm going to do it on my own. And I'm going to start with labor support. I sort of always said that, like, knock on wood, I like don't even want to say this out loud because I'm so superstitious, but like if I ever lost my nursing license, I'd be a doula. And not like, again, knock on wood, that freaks me out. But I was like, I still want to be involved in birth. Let me have my own client base. Let me create my own childbirth classes, do it the way that like I would dream of doing it, being fully independent, and then see where this goes. Really with the idea of everything that you introduced in the beginning of building confidence through education and support. And what I'd learned in the hospital was, and I'd seen it, the families that had the support and had the education had a completely transformed experience than the ones that didn't. And so sort of landing on those key things, education and support being my like goals. So I started Bundle Birth. I quit my job October of 2017. And Bundle Birth was official in January of 2018. So we are coming up on our 5-year anniversary, which is insane. And I just was like, I just want to help. I just want to be a part of it. I want to try to impact from the outside in and see what we can do for the masses. That led me to, on a whim, this was so not the intention, start a YouTube channel. I remember starting the business and being like, if I were a pregnant person, what would I do? I'd Google. So I Googled and it was like a bunch of YouTube videos and there was one and I was like, oh, I can do that. And fast forward like 4 years and over 200,000 subscribers later and hundreds of videos. I'm like, I'm fully a YouTuber now, which again was never the intention. But sort of what I love about this life is that flex and flow. I say flex and flow. And really with my goal just being, I just want to help the world. There's so many amazing people doing such amazing work, you being one of them. And for me to get to offer my giftings in my own unique way, given that I'm my own unique person, was just like so fun. And the hardest thing I've ever done, but amazing. So I started Bundle Birth really with online childbirth classes, in-person labor support, turning virtual, YouTube, social media. And that led me to a sort of a crossroads where I always knew I loved nurses. And I sort of always knew that like, we're not all on the same page. What's being said in the hospital is one thing. What's being said in the community, birth stuff is another. You know, when I was training doulas, I worked for Anna Paula in LA, was teaching childbirth classes. And that was different too, because it was hospital, home, and birth center births. And so learning that side of things, I had clients in various other places and was seeing birth now from like a more macro perspective in LA. And then learning about it worldwide through my YouTube and social media presence. And was just like, the most frustrating thing is they do all the things, they fill in their birth preferences and they're like, I did my homework and like, I'm ready. And they hand it to their nurse and their nurse is like, ugh. And it's the most distant, that one, ugh, is just that one distant. And I remember that because I saw that with one of my clients. And she was like the most quote unquote normal birth plan, everything expected, what they normally do, but she was so proud. And, and I was just like, oh boy. So what I realized very quickly was I can teach patients till I'm blue in the face and they show up to the hospital and they're totally like whacked across the head by the nurses not being on the same page. And so when you think about that impact and that reach, it's like I can touch one family or I can touch a nurse who touches 2 families a shift, 3 times a week, 4 weeks a month into the year. Like that is more impact. And sort of knowing now nurses, knowing the community and kind of having this picture of what's going on, I was like, we got to do something for nurses.
Yeah. So how are you serving nurses?
Yeah. Well, and it led me to how we're serving nurses, which was the first sort of step in because I'm a nurse. I'm offering my nursing self to my patients, but my hands are tied at the bedside. And so instead of the medical way that I was taught of, well, their labor slowed, so start the pit, or let's AROM, let's break their water, like let's move things forward, let's rush the process. I couldn't do any of that. I couldn't call the doctor to be like, hey, yo, let's do this. And so that led me into a practice of using my hands and reading every book on the planet of like, how do I really serve my patients? How do I know the body so well? And then getting to practice that and sort of strategize birth along the way in a physiologic way, which led me to this physiologic birth class, which was our ushering into labor and delivery nurses. So I put together an 8-hour class for nurses, very hands-on, specific to labor and delivery nurses on the physiology of birth and kind of like the training that we all should have given that we're birth people, but sort of stepping back from a nursing perspective, let's walk through every body system and how they all interplay to birth the babies vaginally and safely. So I put together that class and we sold out, which was 46 people in LA in person in January of 2020. And I was like, oh, this is great. Like we sold out, we added a second date, and I thought 46 people, that's amazing. So we did this class, pandemic hits, we have to pivot, we have to figure things out. And my partner, Justine, who's director of nursing at Bundle Birth Nurses, she was like, you got to put this thing online. And I was like, no, put it online. Now to date, we've trained 1,000 over, I think it's 1,800 at this point. Wow. Providers, doctors, nurses, midwives worldwide in physiologic birth. And I will say, I think it's starting to shift the culture. When I go to births, I had a virtual birth 3 days ago and they were like, let's do closed knee pushing. Let's turn to the side. Let's try this. What do you suggest? Like the whole perspective, how they included the patient, the shared decision-making model, all the things I talked about, I'm seeing happen more now, as I would say, partially as a result of the work that we've been doing. So it started with physiologic birth. Then we put together a 12-month mentorship program, which is really all the heavy hitter nursing topics. That's the nursing orientation that I dreamed of having. And it's all on demand. It's virtual. We have nurses all over the country and in Canada in that program. We have a social media presence. And so really, I think that's been the biggest surprise of this whole thing. And really, my soul just is so alive. Like I said, my soul will die here. And I'm so the opposite, living that reality of seeing families transformed, of I feel like putting our mark into the birth world and helping impact nurses so that they can give more evidence-based, more confidence-building, trauma-informed care for these families so they come out whole.
I was wondering if you could share, I know you said you've seen the difference in the nurses, when they come fresh to a workshop or one of your online training programs, they haven't received this education yet. What are some of their questions? What are the nurses like, and how are they at the end of their kind of transformation?
So I think just a knowledge base, I think we know the body, and I think they walk out of particularly physiologic birth going, whoa, there's a lot going on. And there's a lot that I, nursing intervention wise, can do to help support the body to do what it knows how to do. So that to me equates to an added layer of confidence. The other thing that I'm seeing that is a byproduct that I sort of expected, but I think has also surprised me in some ways, is an added love for their job. I think one of my skills is I'm pretty motivational, I'm pretty inspirational. I bring a lot of challenge, but I also bring some grace. And I think by the end, they're like, I am going to be able to do this. I do have control, because there's nothing worse as a nurse of wanting to give your best to your patients and not knowing how. And and I actually have to make a disclaimer that, like, at this point in the class, you're probably thinking about a patient where you're saying, what if I would have done this? What if I would have tried that? Oh my goodness, that's probably what was happening then. And it's easy to beat yourself up. That's moral injury. We talk about that in our mentorship program, where like these nurses are carrying a lot. They work really hard, but also I think they've been ill equipped to handle what's been handed to them. And so to walk out of particularly a physiologic birth class, they're like, huh, I can do this. I have tools. I'm not at the disposal of the doctor's order or the Pitocin or the C-section even.
Mm-hmm.
And I know how to advocate for that with my providers to say, hey, I got something else. I have an idea. Can you give me an hour? And they're doing it, and how good that feels as a professional who's given 3 days of 12 hours a day of their life to these families, that they're feeling more empowered, more confident in their jobs, and less burnout. To be honest, like I see that through mentorship. One of our mentors that I just hired, she did our mentorship program, and she came into mentorship feeling like, I'm done. This is my last ditch effort to like find passion in this, because it's a challenging job. It's emotional. And she walked out being like, I love this again. And to have nurses who love their jobs, and the challenge that we say all the time is like, do you on the outside, so that when you come and you go to enter that room, you clear it away and you offer your best self to that patient. And how good that feels for them, and how much better care the family's getting when they are, and not only their best self, because that is therapeutic communication. That is your approach in a more trauma-informed way. That is removing bias as much as you can. And then it's also this like added expertise of like, I know what's up. I can assess, know what's up, and help them achieve their goals for their birth. Like, how good does that feel?
And it sounds like what they're gaining is new knowledge about how the body works, and then hands-on labor support skills similar to what doulas and midwives are trained in, so they don't feel so helpless when
Yes.
labor isn't progressing or the doctor's saying maybe we should do a C-section. They like actually know how to facilitate normal birth.
Yes. And like back to the basics. I mean, some of the books that I read for the physiologic birth class were like from the 1800s. I'm pulling history to sort of play into everything that we do here. And some of that, I think culturally, we need to go back to what birth was, to start there instead of starting with the medical side. And then the other added layer is the whole shared decision-making model, where we're offering, and the practice change that we have challenged for, it's been as long as Bundle Birth Nurses has existed, is consent for everything. And so that added like, oh, hello, let's just alert to the fact that like, it's not okay that you're doing a vaginal exam without asking them and getting permission from the patient. Like, and sort of like a, you don't know. And I've done it because I'm going to check you now. Okay. Open your legs. Here you go. Like that's, now I think about that and I'm like, cringe, but you just don't know. And so sort of, and I've seen that too. It's so fun to like, whether it's virtual or in person, or hearing the stories of like, I had a patient text me the other day. She's like, I went into L&D for like an NST, and the nurse just kept asking me for permission. And I was like, that's amazing. She's like, I know it kind of got old, but I really liked it. You know, like that's new. That's not the way that we have practiced in the past. And that for me is just like, for me, a way that I can serve the world at large to help them have better experiences.
That's awesome. I love hearing about, it's fun when you can see the culture shifting as you're working on things. And I think it is part of like a wider movement of people becoming more aware of the gaps in our healthcare system and what needs to be changed. And
Mm-hmm.
that's exciting to hear, like, that nurses are actively participating in changing how we do birth in the
Yeah.
US. Yeah.
Well, and we're not stuck. And I think that that's sort of like, I saw that on the patient side. And one of the like things I talk about a lot, whether it be YouTube or classes or whatever it may be, that like, I think there is a stigma and it comes from somewhere 100%. So I'm not saying that this is wrong at all, but there is a stigma that the hospital's out to get you, that the hospital's a scary place, that it's very sterile, it's not therapeutic, it's not healing necessarily in birth. And so to me, I'm like, I think about how I practice as a nurse. And I think, especially the more experienced I got and the more I learned, that hurts my soul that anyone would feel that way about my care. And so, sort of, the other dream is like the majority of people in the United States give birth in the hospital, not the safest first world country to give birth in. And so, as we start alerting the medical team to this, it's like, let's shift it ourselves. And I think it can feel overwhelming as a nurse of like, this is a bigger problem. And I'm only one little fish in the sea. And what we challenge in the physiologic birth classes is that that one patient matters. So when I tell this story of a starfish, and this dad walks around the bend with his son and the beach is covered in starfish. And it's like, whoa, there's so many starfish here. And the kid starts picking up a starfish, throwing it in the water. And the dad's like, there's a lot of starfish here. What's the point? And he's like, throws it back in the water and says it mattered for that one. And so when I think about, we have 300 people coming to our physiologic birth classes, 300 people show up to that beach and every single one of them throws a starfish back in the water, that beach is cleared off real quick. And that's sort of the idea of changing a culture, changing a dynamic. And I'm the dreamer of the world that's like, let's do better. Let's fix it. You know, we can do it together. And I think that was naive of me early on. But now that like we've been at it for a little bit, I'm like, oh my gosh, it really does happen. We actually can change things.
Mm-hmm.
And that's just so inspiring and keeps me going.
Yeah, and not only do nurses affect like the families they care for, but nurses create the culture on their own units. And what they tolerate and don't tolerate can really change a lot. Like if they're tolerating physicians cutting episiotomies without consent, then that's the culture of that unit. But if the
Yes.
nurses are like, not on my shift, they have more power than they realize and they influence each other. And then they create a culture that doesn't tolerate abuse and instead is standing up for informed consent and bodily autonomy
Yes.
and those things. Yeah.
Well, and there's power in numbers too, even for your own confidence. That if you're that nurse that's maybe on the shy side and that like could never imagine pulling a provider aside and being like, I'm uncomfortable because I have a concern. Help me understand this. I have a safety issue. Like if you're that nurse that's nervous, but everyone around you does it regularly and it's a part of the culture, you're going to have a lot more confidence to speak up for what's right than you being the only pioneer in that way. And we're seeing it. There is power in numbers. And that to me is, I think, probably what's driving the change.
Oh, yeah. There's nothing worse than being the only one. I think that's where I usually see the most burnout in nurses and midwives and even doctors. When they're the only one advocating for evidence-based care, they often leave where they are. But if you can get a group of 3 or 4, like it spreads from there. And then the new graduates who come in, they have mentoring and role modeling. And then gradually the culture shifts. Yeah.
Well, and those new grads, those new nurses are really like, to me, the opportunity. There are so many of them. And we see this in mentorship. They come in inspired, thrilled, excited, and like with this picture of birth. And then they get hit by the reality of like, oh, wait, hold on. This is not what it is. And yet when you have those role models that can say, no, you get to create that in your room. And it's the room, it's the starfish. It's not the whole unit. Yes, there are frustrations, but what happens is then you train up and you kind of like all the new ones coming up have a foundation of physiologic birth and they have a foundation of body autonomy and all of those principles that are, to me, expected, but we haven't done well as a medical community in training in.
Yeah. And the nursing community in general, we don't teach that necessarily in most nursing schools. So
totally.
Yeah. So, Sarah, how can our listeners follow you and your work with Bundle Birth? Do you have any exciting projects you want people to know about? Anything like that?
Yeah. So the easiest way is just bundlebirth.com. Everything's there. I'm Bundle Birth on Instagram. There's Bundle Birth Nurses. We actually just launched a podcast for nurses. It's called Happy Hour with Bundle Birth Nurses. So we are getting going. We're like 3 weeks in. Literally, it was launched a couple weeks ago. And so podcasts for nurses, and then YouTube, I'm Sarah Lavonne. I have classes and support and all the things. But if there's anything happening, you can find it on bundlebirth.com.
Thank you so much, Sarah, for coming on. I think my listeners would probably join me in saying that it was inspiring and empowering to hear you talk about changing the culture of nursing, and we are thankful for the work that you do.
Oh, thank you. Honestly, I said in the beginning, it's an honor to be here, but I mean, you, especially a new nurse, and as I was beginning to grow in my practice and start questioning things in a way that like, wait a second, hold on. What is the evidence? I can't tell you how often I'd go to evidence-based birth and be like, oh, thank God for this resource. Because otherwise
somebody already did it.
Yeah. And so the work that you've done, I think about all the giants in the birth world, and I see us as a little fish in the sea, but also like we all have our own beautiful role to play. And you've played such like an important role in my development as a nurse, especially while I was in leadership and at the bedside, but continue to kind of be one of those giants for us that together, I really see that like the work you're doing, the work we're doing, the work other people are doing, it all plays together for the greater good. And so to be a part of that with you really, truly is an honor.
All right. Thank you so much, Sarah, for everything.
Thank you so much for having me.
Today's podcast was brought to you by the Evidence-Based Birth Professional Membership. The free articles and podcasts we provide to the public are supported by our professional membership program at Evidence-Based Birth. Our members are professionals in the childbirth field who are committed to being change agents in their community. Professional members at EBB get access to continuing education courses with up to 23 contact hours, live monthly training sessions, an exclusive library of printer-friendly PDFs to share with your clients, and a supportive community for asking questions and sharing challenges, struggles, and success stories. We offer monthly and annual plans, as well as scholarships for students and for people of color. To learn more, visit ebbirth.com/membership.